election in June, there were many examples of the Ford government talking about the fact that we, the health coalitions all over Ontario, where we're actually not telling the truth when we would report to the public that Mr. Ford and his Conservatives were moving towards privatizing of many of our health services. Some of you might remember at last January before the election, Christine Elliott actually announced that private hospitals would be able to take over some of the surgeries and diagnostics and pediatric cases and cancer screenings. The OHC jumped on this, and we held over 20 press conferences discussing the fact that the government had actually said that they're going to be using private hospitals, and the government denied it. They said that we were wrong, it was inaccurate, and it wasn't going to be happening. However, they kept making statements that they were not going to privatize our healthcare services. And as soon as the election was over, you'll remember that happened in June. Not 2 months later, Mr. Ford announced that he was going to be giving extra funding to new private for-profit surgical clinics. And also at that time, and it continues, he's over halfway through privatizing or giving new long-term care beds to private for-profit long-term care companies. So it boils down to the fact that before this election, the Ontario public were lied to. And so I would say to you that Mr. Ford has no mandate to be doing this, because they denied categorically that they would be privatizing anything. Right now, if you read the polls about the government, you'll notice that Mr. Ford's popularity has plummeted because of his management of healthcare. People love our public healthcare. They want it to continue. Private for-profit surgical clinics are meant to make money. They're not meant to help the public system or support the public system. They're in place to make money. And because of that, that's certainly not any assistance at all to our public health system, which has been struggling for over 30 years with austerity budgets. The idea of giving money to these private for-profit clinics is actually ludicrous. Every hospital in Ontario has OR suites which have been closed either temporarily or permanently. So those could be used to assist in the alleviation of any backlog of surgical procedures. The other thing is that because of our unique geographical area, we probably won't see any private for-profit surgical clinics in our area. Now, that's because, again, the priority of these clinics is to make money. So the profiteers will obviously look to the largest markets. They'll look to London, they'll look to Toronto, they'll look to Ottawa, maybe Windsor, I don't know. But, you know, I would be very surprised if one came to Chatham-Kent. There simply is not the amount of people, if you will, that are waiting for surgeries available in this area for them to make a huge profit. Now, also these clinics that are being discussed right now are biased, if you will, in who they accept as clients. They'll only take those people that can walk in and walk out the same day. So that means that the more difficult cases will always have to go back to the public health system. And so we're not in favor of that at all. Taking less sick patients, charging profits, and simply not what our healthcare system is supposed to be. So I'm going to ask Riley Sanders, who's here with us this morning. He's a staff member at the Ontario Health Coalition. Riley, can you tell them your title? I forget.
I'm the Communications and Campaigns Director at the OHC.
Yeah. I need that. Ask Riley. He's going to play a video for you.
Yeah, and also just before I play the video, we have put links to the full release in the chat, as well as some of the key information there as well, if you want to take a look. That provide surgeries, the Shouldice Hospital and Don Mills. The Shouldice Hospital. So before the election, Christine Elliott announced that they were going to allow independent health facilities to operate private hospitals. This was shocking to us because the Private Hospital Act banned private hospitals 50 years ago for good reason. And Ontario has spent more than 100 years building up a local public hospital system. However, the Private Hospitals Act grandfathered in existing private hospitals, but banned any new ones to be built. It also prevented them from expanding. Right now, there are only 2 private hospitals left in our province that provide surgeries, the Shouldice Hospital and Don Mills. The Shouldice Hospital has been held up as an example for the Ford government to promote their plans to privatize, but this is extremely problematic because the Shouldice Hospital and all private hospitals only take the most healthy patients who are at low risk because they do not offer emergency services or operate ER rooms. So today we have Judy Wolanski with us, and she's going to share her experience with the Shouldice Hospital.
Hello, my name is Judy Wolanski, Judy Wolanski, and I'm a member of the Chatham branch of the Ontario Health Coalition. I want to share with the public our experience regarding a private care clinic. My husband has had an inguinal hernia for a few years, and it is worsening. He wished to access the Shouldice clinic, as we've had friends and family recommend it highly. He had a pre-op assessment in early 2020 at Shouldice, and they turned him down via a letter in the mail. The reason they gave was that due to his medical condition of COPD, there was increased risk, and that he should, and this is almost quoting, have his surgery at a facility where they were better equipped to respond in the event of an emergency, or if an emergency should arise. His surgery is being performed on Monday, October 31st in our local hospital. 2.5 years after he was determined ineligible at Shouldice. We feel that he will do well, as my husband's condition has been quite stable. He is not overweight, he eats well, and he has always been active. In our minds, and evidently in our surgeon's opinion, a good candidate for the surgery. I can't help but worry about the delay in surgeries in the future with the government's plans to enhance and support private healthcare clinics who have a history of refusing patients' treatment. We can't really call them hospitals, as Shouldice as much as admitted they are not equipped as hospitals are to respond to an emergency. In the case of any hernia, there is a risk that the hernia will become strangulated over time, with the additional related risk of gangrene setting in. This is very painful. An emergency surgery would be absolutely essential. Private clinics will be leaving a patient to their own devices to seek alternate plans for treatment when they are denied treatment at the private clinic. Thank you.
Okay, thank you so much, Judy. I just want to clarify for the press that is here that COPD stands for chronic obstructive pulmonary disease, which it's lung disease. And I know Judy's here. Judy, do you want to talk just a little bit about the cost that Shouldice discussed with you?
There. Sorry, I had trouble unmuting. The cost, there was no cost for the initial medical assessment, which they do a physical, complete physical. But it did mention that for Ontario residents, the healthcare or OHIP would cover it. But there might be extra charges. They did mention that on the website. We never got that far, but yes, it would be covered, the basic surgery. And they said he'd be in for 3 days if he was approved. And I don't know why he'd be in for 3 days, but anyway, they said there might be extra charges for accommodation and that they don't submit to private insurance on behalf of the patient, and that would be up to them. So, and other non-Ontario residents do pay, and they say people come from all over the world, but I, would hate to come from across the ocean and then not be proved to be eligible.
Yeah.
That would be hard. I mean, I can't see that wouldn't maybe happen. So yes, there was no money up front or anything. But
thank you, Judy. Thank you. Judy mentioned a 3-day stay in hospital. I believe that hernia surgeries in OHIP hospitals are like a day procedure. Am I right, Judy? So why that matters is that Shouldice is charging OHIP for 3 days accommodation and care. So it's to have your hernia repaired at Shouldice, if you're an Ontario resident, costs the government 3 times what it would in a public hospital. And God forbid you have to travel across the ocean to be told, no, get out. We believe that all of the misleading statements made by the Ford government has not been good for Ontario's healthcare system. And the fact that they're so blatantly lying before election and post-election leads me to wonder exactly what Mr. Ford wants from all of this. Certainly, his polls are dropping, as we have talked about. The public is upset. There are In other areas, there are temporary emergency room closures. And it might be interesting for the press to know that the tiny town of Chesley, which has a tiny hospital, have had to close their emergency room on a temporary basis until sometime in December of 2022. A group of citizens decided to call a town hall meeting to discuss this, and 1,000 people showed up. That is actually overwhelming when you think of the population of the town of Chesley. So people care about this issue, and they want any privatization plans that Mr. Ford has to stop, as do we. Now, at this point, I'm going to open it up to questions from the press. I see we have several press members here. Who wants to go first? Oh, okay.
There's a question in the chat from Tom Morrison. He says there's a problem with his audio. He's asking, what is your action plan to get the Ford government to address these issues?
We have a very strong action plan to make sure all of the people in Ontario know exactly what Mr. Ford is doing and why. And the why is making profits for his contributors and friends. We'll be holding town hall meetings across the province, another press conference tour regarding temporary ER closures. We're going to be doing a lot of demonstrations, all aimed at notifying the public about what's happening. Mr. Ford was elected to a majority government. That's true. But hopefully we can force him to stop coming after our public hospital system. I'd like to remind you that there's been no practical plan put forth to fix the staffing crisis in hospitals, no practical plan to fix the staffing crisis in long-term care or home care. No extra funding has been announced to help our hospitals. I think the last extra funding we got was during the rages of the pandemic. So, some people say, you create a crisis and then you privatize. So that's happening. And we will continue to shout about this from the rafters to make sure that the public knows about Mr. Ford's plans. And by Mr. Ford, I mean his government. In Chatham-Kent, you have a new MPP, Trevor Jones. I don't see that Mr. Jones has said anything about hospitals or long-term care, except to comment that perhaps, good faith negotiations can get rid of Bill 124. Well, Bill 124 is the law now. So I don't think we workers can negotiate a pay raise more than 1%. In Sarnia-Lambton, the incumbent MPP, Bill Bailey, who was reelected, called, quote, a certain coalition was going around saying that privatization was coming, and that was just a lie. Well, that's what he said before the election. It's going to be interesting to see what he says now when he's been caught in his lies. So, Tom, does that answer your question? Probably too much. Okay. And Chatham Voice, anything from you? Okay. If there are no other questions, I will call an end to this little press conference. Thank you so much for attending. We really appreciate it. This is a huge issue. It's a huge issue. Think of those that can't afford private for-profit surgical services. Think of those that have no choice but to go into a private for-profit long-term care bed. Is that the kind of province we want? I don't think so. And one last thing, sort of on topic, we're now in the 8th wave of COVID. The strains of COVID that are coming apparently are worse than Omicron. This means that our hospitals will be full or fuller than they usually are. So if you have a few blank lines in your papers, can you please ask people to get their vaccines? I think we're at 5 now. Can you please ask them to mask up and get their flu shot and wash your hands? Okay. Thank you so much.